What are follicles in ovarian reserve testing? Imagine tiny sacs inside your ovaries that hold the key to your fertility. These are called follicles, and they are filled with immature eggs. Each month, a few of these follicles start to grow, but usually only one becomes the dominant follicle that releases an egg during ovulation. The rest of the follicles shrink and disappear. The total number of these follicles in your ovaries tells us a lot about how many eggs you have left, which is what we call your ovarian reserve. In ovarian reserve testing, doctors look at these follicles closely to understand your fertility potential. One common way is through an ultrasound called an antral follicle count. During this test, a small camera is inserted into the vagina to see and count the tiny follicles, which measure between 2 and 9 millimeters. A higher count means you likely have a larger pool of eggs, which is generally a good sign for fertility. A lower count might suggest a reduced ovarian reserve, meaning fewer eggs are available. Hormone tests also help paint a clearer picture. Anti-Mullerian hormone is produced by cells in early-stage follicles. Its levels in your blood directly reflected how many follicles you have. If AM levels are high, it suggests a healthy number of eggs. If they are low, it might indicate a diminished ovarian reserve. Inhibin B, another hormone, is mainly made by preantral follicles and also helps show how many follicles are present. Follicle-stimulating hormone, or FSH, is measured early in your cycle. When your follicle count drops, your body produces more FSH to try to stimulate the ovaries, so higher FSH levels can point to fewer remaining eggs. In women with endometriosis, ovarian reserve testing becomes especially important. Endometriosis and its treatments can sometimes reduce the number of available follicles. Monitoring follicle counts and hormone levels helps doctors plan the best approach for fertility treatment and manage expectations. But remember, counting follicles gives us a good idea about quantity, not necessarily quality. Even with a healthy follicle count, egg quality can vary, especially in complex conditions like endometriosis. The testing process is straightforward and safe. It usually involves an ultrasound to count the antral follicles during the early days of your cycle, along with blood tests for hormones like AM, FSH, and sometimes inhibin B. These results together give a comprehensive view of your ovarian reserve. Understanding follicles in ovarian reserve testing helps you and your healthcare team make informed decisions about fertility options. It's a valuable tool, especially if you're experiencing challenges with conception or have conditions like endometriosis that might impact your ovarian health. Always consult with a healthcare professional to interpret your results and discuss the best next steps for your individual situation.